Many men take Tadalafil expecting immediate results, but for some, the effect simply does not appear. Frustration grows, insecurity sets in, and confidence begins to crumble. What many don't know is that certain factors can completely cancel out the effect of this medication, making its use ineffective and leading to a cycle of failed attempts. This situation can be avoided with the right information. Small habits, daily choices, and even interactions with other substances can neutralize Tadalafil's action in the body. Understanding these factors is essential to achieving the expected results and regaining control over one's sexual health. My name is Costa, I am a urologist, and today I will explain exactly which 5 factors prevent Tadalafil from working. Simple adjustments can help avoid frustration and improve treatment response, bringing back confidence and quality in intimate life. Before continuing, check if you are already subscribed to the channel to keep receiving health and sexual education tips. If you find this content useful, give the video a like and participate in the comments. Type 1 if you agree with the information or 0 if you have any suggestions. Your opinion helps make the content even more valuable. Tadalafil is an erection facilitator, not an inducer. This means that it does not create an erection on its own, but rather optimizes the body's natural process. Its mechanism of action begins by inhibiting the enzyme phosphodiesterase type 5, which is responsible for breaking down nitric oxide. Nitric oxide, in turn, is a powerful vasodilator, meaning it relaxes the walls of blood vessels, allowing increased blood flow to the penile region. When everything is functioning well, this vasodilation allows the penis to receive more blood, making the erection firmer and longer-lasting. But here is a detail many people overlook. For Tadalafil to work, the brain needs to give the start signal. Without adequate sexual stimulation, the cascade of events leading to an erection does not get activated. Another interesting factor about Tadalafil is its prolonged half-life. Unlike other medications in the same class, it can remain active in the body for up to 36 hours. This doesn't mean the erection lasts for that entire period, but rather that the body will be more prepared to respond to sexual stimuli during that time. Do you want to renew your sex life and strengthen the connection in your relationship? In the digital book Rediscovering Intimacy, Healthy Sexuality After 60, you will find practical guidance to rekindle desire, overcome challenges, and deepen emotional bonds. Click the link in the first pinned comment and discover how small changes can transform your love life. The effectiveness of Tadalafil can be affected by certain factors that cancel out or reduce its effect. And that is exactly what we will talk about now. The first factor that can cancel out Tadalafil's effect is an excess of adrenaline in the body. This hormone, known for preparing the body for danger, has a direct effect on blood vessels, causing vasoconstriction, meaning it tightens the arteries. This means that instead of facilitating blood flow to the penis, adrenaline does the exact opposite. It reduces blood flow and makes achieving an erection more difficult. This mechanism mainly occurs in moments of stress, anxiety, or emotional tension. When the body perceives a threat, real or imagined, it releases adrenaline to increase heart rate, accelerate breathing, and send blood to the muscles. This is the well-known fight or flight state, which is essential for survival but terrible for erections. Men who suffer from performance anxiety often experience this issue. The fear of failure creates stress, which leads to the release of adrenaline, which in turn makes erections more difficult, creating a vicious cycle. Even if Tadalafil is in the body, the constant presence of adrenaline can neutralize its vasodilatory effect. Maintaining emotional control is essential to maximizing the effects of the medication. Relaxation techniques, breathing exercises, and even mindset shifts can help reduce adrenaline levels and allow Tadalafil to work properly. The second factor that can cancel out Tadalafil's effect is excessive alcohol consumption. While many people believe that a drink may help them relax, when consumption exceeds a certain limit, the effect is the opposite. Alcohol acts as a depressant on the central nervous system, reducing sensitivity and the body's ability to respond to sexual stimuli. Additionally, alcohol has a direct impact on blood circulation. In small amounts, it may cause slight vasodilation, but when consumed in excess, it disrupts blood flow, preventing blood from being properly directed to the penile region. This happens because alcohol alters vascular regulation, making circulation less efficient and reducing the pressure needed to maintain a firm erection. Another problem with excessive alcohol consumption is its interference with brain signals. An erection begins with brain stimuli that trigger a series of reactions in the body. When the nervous system is under the influence of alcohol, these signals become impaired, making it harder to initiate and maintain an erection, even with tadalafil active in the body. Men who mix alcohol with this medication and don't see results may blame the drug, but in reality, it's the alcohol that is canceling out its effects. The third factor that can cancel out the effect of tadalafil is the use of certain medications. Some substances alter the metabolism of tadalafil in the liver, either accelerating its elimination before it has time to work, or in other cases, increasing its concentration in the body to the point of causing unwanted side effects. Anticonvulsants such as carbamazepine, phenytoin, and phenobarbital are examples of medications that make the liver work faster to eliminate substances from the body. This means that when tadalafil is taken alongside these drugs, the body may process it too quickly, reducing its presence in the bloodstream and diminishing its effect. Antibiotics like rifampin also speed up this elimination, making tadalafil practically ineffective. On the other hand, some antifungals such as ketoconazole and itraconazole do the opposite. They inhibit the breakdown of tadalafil, prolonging its presence in the body. This may seem beneficial at first, but in practice it can lead to a buildup of the substance, increasing the risk of side effects such as headaches, dizziness, and low blood pressure. For those who use any of these medications regularly, it is essential to consult a doctor before taking tadalafil. Adjustments in dosage or even changes in the timing of use can help prevent the medication's effectiveness from being compromised. The fourth factor that can reduce or even cancel out the effect of tadalafil is the consumption of very fatty meals. Since this medication is absorbed through the gastrointestinal tract, the presence of large amounts of fat can delay and hinder its absorption, reducing its effectiveness at the time it is needed. Foods high in saturated fats, such as fried foods, yellow cheeses, and fatty meats, create a sort of barrier in the stomach, slowing tadalafil's passage into the bloodstream. This means that instead of being efficiently absorbed, the medication may take longer to act or may have a reduced concentration before reaching the desired effect. Additionally, heavy meals divert part of the blood flow to the digestive process. Since the body needs to prioritize digestion, blood circulation concentrates in the digestive system, leaving other areas such as the pelvic region in the background. This can weaken the body's response to tadalafil, as good blood circulation is one of the key factors for its effectiveness. Taking the medication on an empty stomach or with light meals helps ensure proper absorption. Small changes in dietary habits can make a difference in treatment response and erection quality. The fifth factor that can completely cancel out the effect of tadalafil is the lack of sexual stimulation. Unlike what some people think, this medication does not cause spontaneous erections. Its role is to facilitate the process, ensuring that when arousal occurs, blood flow is efficiently directed to the penile region. Without adequate stimulation, the cascade of signals leading to an erection simply does not get activated. The brain needs to interpret a signal of desire to release neurotransmitters that initiate the process. If this trigger does not occur, tadalafil remains in the body without its effect being utilized. This mistake is more common than it seems. Some men take the medication expecting the erection to happen automatically, without any interaction or stimulation. This can lead to frustration, creating a cycle of insecurity and doubts about the treatment's effectiveness. Arousal can be triggered in different ways, whether through physical contact, imagination, or visual and sensory stimuli. Creating a comfortable, distraction-free environment helps enhance the body's response. Men who use tadalafil need to understand that it does not replace arousal but rather enhances the body's response when stimulation is present. The way tadalafil is used can make all the difference in the results. Even if the medication is in the body, certain habits can compromise its effect and lead to unnecessary frustrations. An improper dosage, for example, is a common mistake. Some men believe that taking a smaller dose may be enough, while others think increasing the amount will have a stronger effect. Neither of these strategies works well. Tadalafil has a recommended dose for each case, and altering it without medical guidance can reduce its effectiveness or increase side effects, such as headaches and low blood pressure. The medication's action time also needs to be considered. Although Tadalafil has a prolonged effect, its peak effectiveness can vary depending on each person's metabolism. Some men expect immediate results, but absorption and the body's response may take a few hours. Another important point is the interval between doses. Daily use Tadalafil needs to maintain a constant level in the body to be effective, while the on-demand version requires planning to ensure it is active at the right time. Following medical recommendations correctly and understanding how the substance works makes all the difference in achieving good results. Using Tadalafil without understanding the factors that can cancel out its effect is a common mistake, but it can be avoided. Small details in daily life, such as excessive alcohol consumption, poor diet, or the use of certain medications, can completely compromise the medication's results. Additionally, the lack of sexual stimulation and the impact of adrenaline in the body are determining factors for successful treatment. Now that you know the 5 main reasons that cancel out Tadalafil's action, what caught your attention the most? Leave a comment if you had already heard about the impact of adrenaline on erections. Press the like button so that more people can access this content. Your support makes a big difference in ensuring this video reaches those who truly need this information. If you want to dive deeper into sexual health and improve your performance naturally, there are other videos on this channel that may interest you. Watch them now and keep learning. And if you haven't subscribed yet, take this opportunity to do so now. This way, you'll receive more content like this every week. See you in the next video.